it is a great pleasure for me that I can demonstrate here the research activity of the preclinical imaging subnode of Euro-BioImaging at the University of Pécs. As Linda mentioned, I graduated as a medical doctor, and after that I completed my PhD training at the Department of Pharmacology and Pharmacotherapy. Our research activity focuses on the investigation of activation mechanisms of primary sensory nerves in inflammatory diseases and chronic pain, and on identifying potential novel analgesic and anti-inflammatory drug targets. So primarily we are pharmacologists and pain researchers. So the outcomes, the main outcomes of our studies are functional outcomes, including pain behavior, changes of pain behavior, and inflammatory parameters in rodents. And mainly in our inflammatory research projects, the imaging techniques can be valuable tools to investigate pathophysiological mechanisms. In this work, the establishment of the in vivo imaging platform and the Department of Pharmacology and Pharmacotherapy was a great step forward for us. This imaging platform is the most complex in vivo imaging platform in Hungary. It was established in 2012, and it was dedicated to preclinical in vivo imaging, including optical imaging with fluorescent and luminescent imaging systems, laser speckle imaging, and micro-CT imaging. On the right side, you can see our in vivo imaging team. The head of the research group is Professor Zsuzsanna Helyes. My colleague Bálint Boc completed also his PhD related to in vivo imaging techniques, but now he works as a radiologist, so he specialized later for radiology. And we have a CT technician, Tamás Kis, and he's responsible primarily for micro-CT measurements, and me, who is involved mainly in vivo optical imaging projects. As I mentioned, our research concept focuses on the investigation of primary sensory nerves in inflammatory diseases and chronic pain. And among the primary sensory nerves, we focus on a special subtype of primary sensory nerves called capsaicin-sensitive peptidergic nerves. These nerves have three different functions, have a triple function. Beside the classic afferent function, they have a local and a local efferent and the systemic efferent function as well, and they can produce both pro and anti-inflammatory neuropeptides as well. The pro-inflammatory neuropeptides can induce, for example, vascular responses, vasodilation, plasma protein extravasation, edema, cellular responses, mast degranulation, leukocyte activation in inflammatory diseases. And they can also influence bone and joint remodeling in inflammatory diseases. For example, this so-called neurogenic inflammatory component is very important in the pathophysiology of rheumatoid arthritis, asthma, inflammatory bowel diseases, and inflammatory skin diseases, for example, psoriasis and contact dermatitis. And the previously mentioned imaging techniques provide valuable tools for investigation of these mechanisms in these inflammatory diseases. So, for example, the in vivo optical imaging is suitable for investigation of cellular and vascular responses of the diseases. The laser speckle imaging is suitable also for investigation of vascular responses because it can image blood perfusion changes in tissues at microcirculation levels. And so these equipments can provide us functional imaging possibilities. And in vivo micro CT can provide structural imaging as well. So we use it mainly in inflammatory arthritis and lung inflammation models to investigate inflammation-induced structural alterations. In the following slides, I would like to briefly introduce our imaging techniques and how we can use them practically for answering our research questions. Let's see first IVIS Luminous 3 in vivo imaging system. The disadvantage of this system are that it can produce only three-dimensional imaging. So it has a low resolution, and it can apply only epi illumination. So we cannot investigate deeper tissue structures, only superficial tissues such as skin of the ears and joints. But practically it has more advantages and more important advantages. So it is suitable for both fluorescent and luminescent imaging. So, for example, moreover, in the same animal, we can concurrently investigate multiple biological events with the fluorescent and the luminescent dye, as well as with the concurrent use of a fluorescent and luminescent dye if their emission wavelengths are not the same. And further advantages of this system that we can investigate wide range of subjects, including mice, rats, cell culture places. So in the measurement area, we can investigate, for example, 2 mice. And it can increase the time efficiency of this method as well. So the measurement processes are quicker in case of mouse studies. In case of rat studies, we can see only half a rat in the measurement area. So in this case, the imaging process is slower because we can measure only one rat at a time. And of course, the rats requires higher amount of contrast agents as well. So therefore, we prefer mice in these studies. And this system is also suitable for in vitro measurements, so we can place also one plate as well into the measurement area. So in vivo optical imaging means actually the detection of visible light photons originating from living animals. And we can classify this, so we can classify it based on the way the photons are generated. So we distinguish in vivo luminescence and fluorescence imaging. And in both modalities, there are two strategies with which we can generate photons. So the first strategy is the use of genetically engineered animals. So these animals can stably express a luciferase enzyme or a fluorescent protein originated from North American firefly or crystal jelly, respectively. And we can use also exogenous imaging agents. The luminescent contrast agents are usually substrates of targeted enzymes or oxidative agents. The fluorescent imaging agents can be targeted agents, activatable probes, and vascular dyes. Among genetically engineered animals, in the recent period, we intensively used gliofibrillary acidic protein luciferase GFAP plus transgenic mice. So the GFAP is an astrocyte marker, and in the central nervous system, only astrocytes can express GFAP. Therefore, via GFAP expression, we can investigate even astrocyte activation in the central nervous system. Astrocyte activation is one of the mechanisms of neuroinflammation, which is a very important mechanism in pathomechanism of pain, particularly in central sensitization process of pain leading to chronic pain. So in these mice, beside the GFAP promoter, a luciferase reporter gene was inserted. This transgenic mouse strain was developed by Taconic Bioscience, and we bought two breeding pairs from Taconic. And now we can breed them in our animal house. And so after neuronal stimuli, GFAP expression can increase, leading to increase of expression of luciferase enzyme as well. And if we use a suitable luciferase substrate exogenously, we can produce a luminescent signal and we can detect this signal with the help of in vivo optical imaging. So one of the most important limitations of this mouse model was that we had no appropriate luciferase substrate, which has a good blood-brain barrier penetration and appropriate biodistribution. Therefore, the in vivo investigation of astrocyte activation could not be investigated for a long time. But in the recent years, a novel synthetic D-luciferin analog was introduced called cyclus 1. It is chemically cyclic alkyl amino luciferin. And this compound has better blood-brain barrier penetration compared to the conventionally used D-luciferin. So the development of this new luciferase substrate can open lots of doors in the research of neuroinflammation and pain as well. So we also designed a study to investigate this new luciferase substrate in a neuroinflammation model, and we optimized the GFAP mouse model in a TNF-alpha induced neuroinflammation model. And of course, in the first step, we try to choose the adequate dose of this compound. And in the first step, we measured only the basal GFAP expression in the brain, in GFAP transgenic mice, in the different doses. And as you can see on both on the representative images on the graph, cyclus 1 can induce higher luminescent signal intensity compared to D-luciferin. So interestingly, the ears of the mice contain also GFAP positive cells, and we can see luminescence signal from the ears as well. Due to the lower blood-brain penetration of D-luciferin, we can see higher luminescence signal from the ear. But in cyclus 1 injected mice, we can see lower luminescence signal level from the ear and parallelly higher luminescence signal level from the brain. So for the yes, and the other main outcome of this study is that we determined the optional measurement time point, and as we can see, we can reach the maximum luminescent signal intensity at 10 minutes. And we chose the adequate dose as well. We chose 7.5 milligram per kilo dose for the further investigations. In the next step, we investigated GFAP expression increase in TNF-alpha in the neuroinflammation model, and we use, of course, cyclus 1 as a contrast agent, and we can see that cyclus 1 is appropriate, it's suitable for investigation of time-independent we have TNF-alpha-induced time-dependent astrocyte activation. We confirmed this in vivo data with ex vivo as well. So we can see a little bit higher, but not significant intensity, luminescent intensity increase ex vivo. But we got the same results ex vivo compared to in vivo studies. So Cyclus 1 is suitable for GFAP expression measurement in the brain of GFAP Lutz transgenic mice. Cyclus 1 can be used and can be used not only in GFAP Lutz mice. We can use it peripherally as well in a murine model of breast cancer, for example. So we inoculated mice with 41 breast cancer cells transfected with luciferase enzyme orthotopically into the forced mammary glands fat pad. And with the help of Cyclus 1 and in vivo luminescent imaging, we can imaging the tumor growth and viability. And one of the big advantage of this method that we can follow the disease progression in the same animal. And we can also detect treatment responses in the same animal. In this study, we investigated the effect of lipid RAF disruptor, methyl beta cyclodextrin, which increased the tumor growth and viability. Okay, let's see other exogenous luminescent signals. So luminol, luciganin, and L012 can be used for these purposes as well. Luminol is a diffusible contrast agent which can penetrate the neutrophil phagosomes as well, and it is oxidized by myoperoxidase. So with the help of luminol, we can image neutrophil myoperoxidase activity, which is a very important cellular marker in several inflammatory diseases. With luciganin, we can measure macrophage activity, because luciganin is oxidized by superoxide ion produced by not PAH oxidase. L012 is similar to luminol, so we can detect reactive oxygen species production. It is more potent compared to luminol, but it is less sensitive, so we cannot investigate specifically enzyme activities which can produce reactive oxygen species. So I would like to show you some example for the application of these exogenous luminescent agents. As I mentioned, luminol is specific for neutrophil myoperoxidase. It was proved by Gross et al. That it is specific for neutrophil myoperoxidase. So in myoperoxidase knockout mice, we cannot see any signals. We can use this agent mainly for investigation of joint diseases. On this slide, you can see the application of luminol in a serum transfer-induced arthritis. This is in this case, arthritis is induced by passive transfer of autoantibodies. And we can visualize this important cellular marker of the inflammatory process in the joints. And we can, of course, follow the course of the disease as well with the help of this method. In this project, we investigated the effect of our novel patented multi-target analgesic drug candidate. As we can see, our agent, our compound could significantly decrease neutrophil malperoxidase activity in the early phase. We can use luminol as well in contact dermatitis models. For example, in this study, investigate the role of a neuropeptide called galanin in oxazolin-induced contact dermatitis. So the big advantage of this model that we can perform it in self-control manner. So one of the ears is on the one of the ears vehicle is applied, and on the other ears oxazolone is applied, which can induce contact dermatitis-like symptoms involving neutrophil activation as well, which can be visualized with the help of in vivo luminescent imaging. On this slide, you can see the application of L012 in complex regional pain syndrome model. Our research group developed this translationally relevant mouse model. Immunoglobulins obtained from human patients are transferred to mice. And after a small incision on the hindpaw, these immunoglobulins can produce CRPS-like symptoms in the mice as well. And it's with in vivo optical imaging, we can visualize reactive oxygen species production as well in the model, and we can follow the disease course as well. This compound is also appropriate for ex vivo measurements as well. For example, in experimental lung inflammation model, we cannot perform in vivo imaging, as you can see here below, that this method is not suitable for investigation deeper structures. But ex vivo, we can see high luminescent signal intensity after RPS induction as well. In this study, we investigated the role of a neuropeptide called tachykinin 4 in this model. Okay, after luminescent agents, let's see some examples for application of exogenous fluorescent agents. As I mentioned, these agents can be targeted, activatable, or vascular dyes. Targeted fluorescent agents bind specifically to target biomarkers. I would like to highlight, for example, bone remodeling, which we can visualize with the help of OsteoSense. OsteoSense is a bisphosphonate-like compound which specifically target hydroxyapatite in the bones, and it can accumulate in the bones. So with the help of this contrast agent, we can visualize the bone turnover, the metabolic activity of bones as well. In this study, we investigated the effect of desensitization of capsaicin-sensitive nerves in an antigen-induced arthritis model, in proteoglycan-induced arthritis. And as this kind of arthritis can cause intensive bone turnover in the joints, in the knees, in the ankle joints, and in the spine as well, as you can see on the representative images. But desensitization of the capsaicin-sensitive nerves could not influence the degree of bone turnover. We can use this contrast agent in degenerative arthritis models as well. For example, in monoiodine acetate-induced knee osteoarthritis, we investigated the effect of our patented multi-target drug candidate in this model, but it cannot influence the bone turnover in this osteoarthritis model. Activatable fluorescent markers are optically silent. They are quenched, and in vivo they can be activated by enzymatic cleavage. The target protease biomarkers can activate them specifically. For example, matrix metal proteinases or catepsins. In our arthritis studies, we usually use the MMP cells. For example, you can use the application of this agent in monoiodine acetate-induced osteoarthritis, or monoiodine acetate could induce intensive MMP activity, increase in the affected joints. We investigated it is the same study that I mentioned previously. So we investigated the effect of our multi-target analgesic candidate in the model. It cannot influence the MMP activities in the knees. We can use these contrast agents, these activatable contrast agents in tumor models as well. I also mentioned already our breast cancer model, in which we can investigate protease activities, the role of catepsins. They are very important in the pathomechanisms of tumors, and with the help of ProSense, we can visualize the catepsin activity in vivo. We investigated the effect of methyl beta cyclodextrin in this model, which had no effect on protease activity. We can use also vascular fluorescent markers as well, which can be distributed intravascularly, and they can exit only inflamed and damaged leaky microvessels. We can use them in stable micelles or micromolecules as well. We extensively use IR 676, which is a vascular fluorescent dye developed by our research group. It is transferred in a stable micelle, and it can exit, for example, inflamed area. So we can visualize plasma protein extravasation with the help of this dye in different arthritis models as well. So, for example, in this case, you can see plasma extravasation in KBX and serum transfer arthritis. We can follow the disease course and this process in the same animal, and we can also investigate the effect of compounds, or in this case, the effect of chronic restraint stress on the disease course of arthritis. And in this case, if we can see on the maximum of plasma extravasation, the chronic restraint stress can decrease this important vascular signs of inflammation. We can use vascular dyes in tumor models as well. Angiosense is a macromolecule which can exit aberrant vessels in the tumors. And as we can see on this slide, our investigated lipid raft disruptor can increase the plasma extravasation and angiosense extravasation in the model, leading to increased angiogenesis, or explained by increased angiogenesis in the model. The IVIS Lumina system has several disadvantages, as I mentioned. So mainly, we cannot investigate deeper tissue structures with IVIS, and it has low resolution. So the recent advances of in vivo optical imaging focuses on the improvement of resolution and tissue penetrance. In case of fluorescent imaging, fluorescent molecular tomograph is an important improvement. In this case, we examine the animals sequentially at several surface points, and emitted photons are also detected by different or from different sites. So it can measure the density of the light, and this method can decrease the photon absorption and scattering, leading to deeper tissue penetrance, and it enables three-dimensional imaging as well, leading to higher resolution. But of course, the disadvantage of this method that it is suitable only for fluorescent measurement, and we can measure only mice and only one mouse in a special cassette, so the time efficiency is lower of this method. Yes, on this slide you can see the in vivo imaging of plasma extravasation in LPS-induced lung inflammation. As I mentioned, with IVIS, we cannot perform in this case in vivo imaging, but with fluorescent tomography we can measure this vascular response in vivo as well. We can measure cathepsin activity and vascular leakage in breast cancer model as well. With this method, we can get higher resolution in this case, and we can measure in this case the amount of fluorophores in the mice. Osteosense can be used also in this method, and we can visualize bone turnover in proteoglycan-induced arthritis similarly to IVIS in this case. And the big advantage of FMT that we can create hybrid systems which further increase the sensitivity and resolution of the method, so it is suitable for FMT CT co-localization, and with the help of CT, a micro CT, we can localize the localization of the fluorescent signal. And at the end, I would like to say some words about laser speckle imaging and in vivo micro-CT imaging. The laser speckle contrast imaging is suitable for investigation of blood perfusion in tissues and microcirculation levels. I am not involved in these studies. My colleagues who perform dermatitis models use usually this method, but recently I was also involved in the study in which we investigated the effect of hydrogen sulfide compound and the role of TRPA1 receptor in the mode of action of this hydrogen sulfide compounds in plantar incision surgery of the hind paw. So as you can see, we can visualize blood perfusion on the hind paws in this model, and we can see vascular responses as well. And a few words about micro-CT. It is suitable for structural measurement and quantitative morphometry as well. And we can investigate sample specimens, living animals as well. I used this method mainly for investigation of structural alterations of bones in arthritis projects. We can measure tissue volume, tissue surface, tissue connectivity, tissue density, tissue porosity, and erosions with the help of this method. So we can follow up bone microarchitectural changes in proteoglycan-induced arthritis or other arthritis models, for example, in monoiodoacidate-induced osteoarthritis as well. And as I mentioned, we can investigate the lung structure as well. For example, on this slide, you can see the effect of cigarette smoke exposure on the alveolar structure. So on the left side, as you can see, the morphological images are not so informative, but the quantitative analysis can show us emphyematosus changes in the lung, which was confirmed by histology as well. So as a summary, we can say that these in vivo imaging techniques provide highly sensitive, non-invasive, time and cost-efficient preclinical modalities for identifying pathophysiological mechanisms and monitor disease progression in inflammatory conditions, cancer, tissue destruction and degeneration. They are also used in preclinical pharmacological research and in drug development as well. And with the help of this method, we can reduce the biasing effect of biological variability, and we can reduce the number of animals needed for the experimentation. So thank you. Thank my colleagues who were involved in these studies, and thank you for your attention as well.